COVID-19 pandemic, Human Resources was forced to pivot and refocus our efforts on policies and programs as a result of issues that the pandemic brought into the workplace. The Pandemic Recognition Program was implemented as a response to our employees that were required to perform work but were at a greater risk for the COVID-19 exposure. The telework and alternative schedule policy was implemented due to the pandemic as we had to close our buildings and send our employees to work from home.
VOSH is basically Virginia's OSHA wing, and they put together a mandate about having training for employees. But what we decided to do in order to make sure everything was up to speed and really met all the requirements is we put together a video. It was about a 20-minute video that reviewed all the VOSH requirements and also went over a lot of the efforts that we had done as a county to keep employees safe. Infection control is always a part of a safety program. I'd say on a typical year, our infection control team has between 10 and 20 cases that we manage. This year, I think we're close to 700 at this point. So exponentially different than years past. We work with the health department. Here it's the Blue Ridge Health District, and we actually help talk to employees when they are either sick and have symptoms or they might be exposed, and we talk them through their situation. And so we help them if they need to get a test, or we help them to understand, yes, this is an exposure, and maybe no, this other situation is not an exposure. And then if indicated, we help them understand what it means to quarantine and what it means to isolate at home. And we are available 7 days a week. We are available on holidays. We answer the phone sometimes at midnight, sometimes at 4:30 in the morning, all day long. We try to be as available as we can.